placing this patient here for physical assessment, which includes the inspection, the palpation, the percussion, and also the auscultation. In inspection, this is we use to inspecting the patient's breathing and clothing. Also, this inspect our patient's color of the skin for any lesions and abnormalities. Also, for palpation, it consists by using our hands and fingers to palpate or to feel any masses in our patient's body that can't be seen on our eyes. Also, in auscultation, by using instruments such as stethoscopes and sphygmomanometer for listening. I'm your nurse for today, and I will be assessing you for a physical assessment. And now I'll be getting your name. What's your name, sir?
Anyway, I'm Joseph.
Your birthday?
March 19, 2000.
Okay. Now I will be getting your blood pressure, your temperature, and also your heart rate. Okay, your BP is normal. It's 120/60. Now, you'll be getting your height and weight, and as well as your BMI. Now, I'll be asking you, do you feel any pain? Do you feel any pain in your body right now?
Nothing.
His skin color is light brown, and as you can see, there's no lesions or abnormalities can be seen in his body. Also, he's in a proper hygiene. He has a good posture, and he is calm at all. And his face is symmetrical, and there's no drooping on one side. Also, his eyes and ears are at the same level. Now let's palpate his head to check for any masses or skin breakdowns or any infestation. Now let's palpate the side of his head, at the back of his head, also in the top of his head. Okay, there is no sign for any masses and also for skin breakdowns, and it is very normal. Now let's palpate his temporal artery. Okay, good, it's normal. Now for his face muscle. Okay, it's good. Now let's check for his sinuses, and I will add a little bit of push here. Let me know if there is any pain. Okay.
No,
Do you feel any pain?
nothing.
Okay, good. His sinuses is very normal. And now let's inspect his eyes to check for jaundice or sign of jaundice or erythema. His eyes is normal. There's no swelling, and there is no redness, and eyelid is pinkish. There's no sign of jaundice or erythema. It's normal. And now let's palpate his ears. Do you feel any pain in your ears?
I don't feel anything.
Okay, good. Let's palpate his ears. Do you feel pain here?
Nothing.
Okay, good. As you can see, there is no redness in his ears or any lesion or abnormalities, as you can see. And his ears is very normal. Now, okay, let's check the airflow of his nose. I'll be pushing the side of your nose to see if there's any blockage. Just tell me if it's painful or you feel any blockage. Do you feel any? Okay, good. Do you feel any? Okay, good. Can you make your face You look up to see, I'll see your nose inside for any sign of drainage. Okay, good. Now I'll check your mouth. Your lips is kind of pinkish, and I can see no sores. Now, can you open your mouth? Okay. Can you make your tongue out? Okay. Your tongue is moist and there's no sign of sores. Okay, now let's check his trachea, if it's in midline or if it's painful here for signs of lesions and abnormalities. Do you feel any pain here? Okay, good. Now, let's auscultate his trachea, his carotid artery. The other side. Okay, it's normal. Now we'll be palpating his pulse. Check the pulse. The other side pulse. Check the brachial pulse. Okay, now let's check his nails. His nails is normal. There's no sign of claw fingers or anything. And sign. Let's check for nail refill. It's good. It refill in less than 2 seconds. And now let's test for strength. Can you squeeze my hands? Okay, good. His strength is good. Now check for any lesions or stop or abnormalities for his body in his hands. No, there's no lesions and abnormalities in his hands. He is completely normal. And now let's check for his palpate his heart, or let's check his chest. Okay, let's check his heart, the rhythm of his heart. Love dub, exclamation. That's good, it's normal. Now let's auscultate your lungs. Breathe in, breathe out. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, it's normal. Now we'll be assessing his abdomen.
Ayun.
I'll ask you a question. Do you feel any stomach issues lately? Okay. How was your bowel movement? When was your bowel movement?
2 hours ago.
Okay. I'll auscultate your stomach to hear your bowel movements, or if your stomach is hypoactive or hyperactive. Let's check the four quadrants of your stomach. The left upper quadrant, the lower left quadrant. Okay, good. Now let's palpate the fourth quadrant, the lower right quadrant, the upper right quadrant, the left upper quadrant, the left lower quadrant. Do you feel any pain? Okay. You can see his skin or his body is no sign of lesions and abnormalities, and his quadrants are normal. Now let's check his lower extremities, his legs. Now as you can see, there's no lesions, there's no abnormalities, and his legs are very warm. That's good. Let's palpate his tibia bone or tibia bone here to check for edema. Okay, the left side. Okay, it's good. And now let's check for his bone here. Okay, there's no sign of edema. And that's all. That's how you assess physical assessment on IPPA, for which includes the inspection, the palpation, the percussion, and auscultation. And that's all. Thank you.